Good morning, everyone. I'm happy to be here and thank you for having me. My name is Dr. Karl Szafranski. I'm a family medicine physician with Dooley Health and Care, and I'm happy to be talking to you about COVID-19 today. So just so you know who you're talking to, and I'd like to always kind of share a little bit about myself. First and most importantly, I have no financial disclosures. So Moderna or Pfizer or Johnson and Johnson, they have no financial hold on me. I'm not paid to endorse their products. I'm not um, hired by any pharmaceutical company to share this information with you. I'm sharing it with you because I think it's the right thing to do. And as a family doctor, I'm very passionate about protecting as many people as possible with regards to COVID. I'm board certified in family medicine. I completed my medical school training at the University of St. Louis in Missouri in 2013. I then did my medical residency in Greenville, South Carolina, only to return home to the Chicago suburbs where I grew up. I've been an employee with Dooley Health and Care, formerly known as DuPage Medical Group, since 2016. I originally started my practice in Joliet, Illinois, and I've since recently moved to Orland Hills to focus on patients in the Medicare and Medicare Advantage population. So usually most of my patients are over the age of 65. Um, I'm not an epidemiologist. I'm not an infectious disease doctor. I'm a family medicine doctor who's been, like you, dealing with COVID for the last 2 years. It's hard to realize that it's been 2 whole years, but I feel like we've learned quite a bit along this way. So hopefully we can share a little bit more with you today. Personal stuff about me, since it's March Madness, I want to share my passion for the University of Illinois basketball team. So go Illini if there's any Illini fans out there. And on another note, I always feel this is an important topic to talk about because at home I have a 2.5-year-old and I'm eager to end this pandemic as quickly as possible so he can continue to grow up in as normal environment as possible. So the basic objectives of this presentation, we're going to be talking about what COVID is. It's probably a topic most everyone knows a good amount about. I'm going to give you a little update on the current state of the pandemic in Illinois based upon data from the Illinois Department of Public Health. We're going to discuss the 3 current vaccines for COVID. We're going to talk about how they're administered. We're going to discuss boosters. Then we're going to go into discussing some of the side effects because as a family physician, I feel like that's been a common question patients have had when they've approached me about discussing the COVID vaccine. Finally, we're going to talk about current COVID therapeutics, meaning if you have COVID, what are the options for treatment? And we'll discuss quarantine and isolation protocols because that's been an especially confusing thing for people, and including myself. They seem to be changing quite regularly. So I'll give you an up-to-date current update on COVID quarantine and isolation protocols as of today, March 15th. I'll have some times for questions if anyone has any, and we'll get going. So just so everyone's aware, if you have any significant questions personal about this topic I've presented, all I ask, and one of my goals is that you have this discussion with your family doctor. I can't force you to get a vaccine. I don't want to force you to get a vaccine. I just want to force you to have a conversation if I can, because there's so much misinformation out there that's so confusing that I feel like the best solution is communication, and hopefully you'll feel a little bit more empowered and inspired to speak to your family physician after we're done speaking today. So to put everything in perspective, it helps me to kind of share why I wanted to speak to you today about COVID. there's a face to COVID that I don't forget about. And one of the biggest reminders this time of year, with it being the Easter season, is one of my patients named George. So I'll tell you about George. George was one of my earliest patients when I first began practice in the Chicago suburbs. He's a devoted father of two. He's a husband of 55 years, grandfather of six children. He is full of life, and he just was such a wonderful man for me to get to know for several years. I remember the very first time I met him, he said, "Doctor, you have to come over to my house for Greek Easter." And I was put back because, I had barely spoken to him for 5 minutes, but I soon came to realize that he was quite serious about this. Um, and every time I would see him, he'd say, "Doctor, you got to come over to my house for Greek Easter." And I finally did, and I had a wonderful time. And every time I saw George, no matter how sick he was, he always put a smile on my face and made me happy. He was a great patient. Everything I told him to do, he was compliant, and he took his medications as I described. He followed diet recommendations as I described. He just wanted to listen and learn about what I had to say. Um, Unfortunately, in November 2020, he ended up being hospitalized after contracting COVID. He really wasn't doing well. He needed an increased amount of supplemental oxygen. He was having a harder time breathing. He ended up being put on the ventilator. Unfortunately, as we've learned with COVID, um, once you're on a ventilator, it oftentimes becomes difficult to get back off of it. George did not improve, and he ended up passing with his family at the bedside due to COVID pneumonia. I think about George all the time. I think if we had the vaccine available, George would have gotten it. Um, but we didn't in November 2020. So he was a life that was lost, and lost definitely too soon, because we still had an opportunity to get to know each other even more. And he still had a lot of love to spread throughout this world. So I miss George. And I want you to know I'm serious about my COVID discussions, and I care greatly for the opportunity to help a single patient if possible. So, what is COVID? COVID is a disease caused by a virus called SARS-CoV-19. It was first discovered in China in 2019. Coronavirus is the family of viruses with which it belongs. Coronaviruses are very common. They cause a spectrum of illnesses: common colds, chest colds, pneumonia, viral pneumonias. But coronavirus in the SARS family um, are even more infectious and can cause more significant problems. Coronavirus is spread through the respiratory system, meaning you're breathing out respiratory droplets, which contain viral particles, which are inhaled by those around you. Coronavirus, COVID, is extremely infectious, estimating that around 5 to 7 people are infected, based upon the original strain that came about in 2019. So in other words, every one person who has coronavirus probably shared it with 5 to 7 other people, which explains the pandemic rapid spread of this virus. It's been very interesting to be a physician during this COVID time, because I've learned to suspect COVID essentially with any type of symptom. There's a broad range of symptoms that it causes: fever, cough, muscle aches, fatigue, congestion, respiratory distress, um, gastrointestinal upset. There's been numerous asymptomatic cases where people are positive, walking around without any problems. That makes it especially difficult to control and difficult to contain. Um, we also can't make heads or tails of the severity of COVID cases. We do correlate the severity with risk factors, including obesity, having diabetes or heart disease, high blood pressure, previous histories of being immunosuppressed. So That's been helpful to know, but I've also seen many patients who've been extremely healthy who have quite severe illness. So to give you an update on the current status of COVID, again, this data is coming from the Illinois Department of Public Health. Okay, this is splitting up the state of Illinois in our transmission zones. And right now, things are doing actually quite well with regards to COVID status. So we're basing these metrics primarily off of this statistic called a 7-day rolling test positivity. Okay. So essentially, that's taking the number of positive tests that we've had over the last 7 days, dividing that by the total number of tests that have been taken. So that means about, as of March 8th, 1.2% of tests have been positive over the previous 7 days. So you could think there's been 1.2 cases of COVID out of every 100 people tested on average over the last 7 days. This dashed line here indicates the 8% kind of threshold, which is kind of the level where we might start increasing COVID measures to mitigate the spread again. So currently we're well below that. We're pretty comfortable. These are the current state of patients who are hospitalized with COVID, and this was as of March 10th per the Illinois Department of Public Health. And this is just looking in suburban Cook County, which is where I'm practicing and where I'm following more of the data. So again, this is a 7-day rolling average. So meaning taking the previous 7-day totals divided by 7. As of March 10th, we had about 162 patients in the hospital in suburban Cook County Region 10 with COVID-19. Doesn't mean COVID needs to be forgotten about and we're done with the risks associated with it. So here are the daily mortality rates for COVID as of March 8th. Okay. And per the data that we had, there's been 24 additional lives lost as of March 8th. Okay. We've definitely gone down on our peak for our mortality, but it's something that we still have to take seriously because in the state, 24 additional people lost their lives due to COVID-19. So how can you interpret that data? And this is kind of the view that I'm taking of it. Currently, our healthcare facilities are handling the current COVID load. Okay. So there's not a shortage of beds. There's not a shortage of personal protective equipment. There's not a shortage of ventilators. We're able to deal with taking care of our current levels of COVID people. We are in a valley, meaning it's a low number of cases right now. It may increase and we may have another peak of COVID in the coming months to weeks. We just don't know. COVID still warrants our attention, but there's still light at the end of the tunnel, okay? To show you how far we've gone with regards to COVID, let me share this next graphic with you. And this is just a daily case count, okay? The number of new cases that have occurred as measured in the last about 4 months, I believe. And you could see peaking on January 4th right here, we had 55,000 cases of COVID, which is just absolutely remarkable. Here we are, just over 2 months later, mid-March, and we've gone down to under about 1,000 cases per day. So COVID changes very rapidly. There's going to be an increase in the number of cases very quickly, and then pretty much a rapid decline as well. But it just goes to show you, blink and you'll miss these changes. So part of what got me interested in medicine when I was younger was reading about the Spanish flu that occurred in 1918 to 1919. I read about this when I was in junior high in a science class, and I was just amazed that something like this happened. And, it wasn't in a history book. I read it in my science course. Um, but the Spanish flu of 1918 to 1919 killed estimated 40 to 50 million people. I mean, it's just mind-boggling. COVID is essentially the second biggest pandemic, which occurred over the course of 2 years in the last 100 years. So COVID's been estimated to be the cause of death for 6 million people right now. HIV is listed on here. That's caused 25 to 35 million deaths, but that's been prolonged over the last 40 years. So to have COVID be the cause of 6 million deaths in 2 years is just mind-boggling to me, and it definitely warrants our attention. We're living through history, and my son's going to be reading about COVID in his history book, I'm sure. And again, goes back to that number: 6 million people. It's estimated by the World Health Organization to be lives lost to COVID. And I think that's an underestimation, to be honest. I don't think we're ever going to fully grasp the effects of COVID. For example, people who were hesitant to go see a physician might have missed out on medical treatment that could have saved their lives. Busy hospitals probably weren't able to admit people who usually were because they've been dealing with COVID. So I think we're underestimating what COVID has done, and we all know about the personal implications, whether you've lost a loved one or a friend, or whether or not you're dealing with the stress and anxiety of COVID and how that's affected you. This is just a remarkable time, but hopefully we learn our lessons and we get through this stronger together, and I certainly hope so. Because there's light at the end of the tunnel, and I look at this picture every time I go into my office. It's Norman Rockwell's doctor picture of the child getting the vaccine. And I really think that the best solution to minimizing the effects of this pandemic remain vaccination. So that's what we're going to talk about next. Currently, there's 3 vaccines that are approved to be given in the United States for COVID-19, okay? There are 2 mRNA-based vaccines, so Pfizer and Moderna, which I'm sure most everyone has heard of, and then 1 viral vector-based vaccine, Johnson & Johnson, okay? Here's kind of a easy graphic from the CDC based upon how these vaccines work. So I'll go over just kind of a quick outline of how the mRNA vaccines work. I found that when I kind of explain that to my patient, it eases some of their fear or distrust of this vaccine and perhaps encourages them to seek out a vaccination for themselves. But how it works is a tiny blueprint, also called mRNA, is encapsulated and transported and injected into our bodies, okay? This is absorbed into our immune cells, where it gives our bodies instructions to make a protein. That's what mRNA is. It's essentially a blueprint for a protein, okay? Our bodies produce mRNA and we make proteins off of that. And that's how a virus uses itself to replicate. It uses mRNA as well. So after our body picks up that blueprint, it starts producing copies of what's called the spike protein. So if you go back to that previous picture of coronavirus, these little red things are the spikes, okay? So we produce tiny copies of that, and we have them float around our body for our immune system to recognize. And our immune system says that doesn't belong here. Let's start to produce antibodies to that. These antibodies, once they kind of make the correct match, they start being produced in higher quantities, and that gives us that immunity to coronavirus. Viral vector vaccines, which is the Johnson & Johnson vaccine, work somewhat similarly. They use a copy of a virus that cannot replicate, and it's encoded with that instruction on how to make that spike protein. and that's injected into our bodies. That virus, gives our cells those instructions to make that spike protein, and the same process occurs. So antibodies develop against that spike protein, and we have immunity. It's very normal to have a reaction to these vaccines because our immune system is so active when it recognizes these things. And that's kind of a consequence of having a good immune system. So that's a good thing. So next, I want to go over the vaccine schedule. And when we say schedule, I mean who's eligible for a vaccine and um, when you should be getting your vaccine, okay? And this is an important slide. As you can see, it lists the three different vaccines: Johnson & Johnson, Moderna, and Pfizer. Okay, there's only one vaccine currently available for children aged 5 to 11 years old, and that's the Pfizer. Okay, Moderna is for adults, and Pfizer children ages 12 and older. So the first dose is given, and then for Pfizer and Moderna, the second dose is given either 3 to 8 weeks or 4 to 8 weeks after your first dose. Okay. Initially, it was recommended that Pfizer be given 3 weeks after your dose, and then Moderna 4 weeks after your first dose, but they've extended that out to 8 weeks, as they felt that it gives you a little bit better protection against some of those side effects from the vaccine. Finally, Johnson & Johnson, they recommend it was a one-time dose, and that's how it was kind of thought to be a very effective alternative to Pfizer and Moderna, because it was a one-time, you get it, you're all done. But since we've come out with the recommendation to get boosters, they say now 2 months after your dose of Johnson & Johnson, they would like you to get a second one, okay? Boosters are approved for all adults, okay? And then children, pardon me, all adults after the age of 18 years old. And for Pfizer, it's 5 months after your second dose. For Moderna, it is also 5 months after your second dose. Currently, the CDC recommends that mRNA vaccines are preferred over the viral vector-based vaccines like the Johnson & Johnson. And this is due to that concern for thrombosis that you might have read about in the news when Johnson & Johnson first came out. Contraindications to the vaccines include an allergic reaction to the past vaccine dose, or a severe allergy to polyethylene glycol, which is common medication called Miralax. You might have taken that before. It's like a stool softener to help with constipation. If that's the case, it's okay to receive a Johnson & Johnson vaccine after you're discussing with your physician. Another contraindication is a history of thrombosis with thrombocytopenia. So that's that blood clot problem that was associated with some of the Johnson & Johnson cases. So there's been a lot of news about getting a fourth shot lately, and currently the only recommended group to receive a fourth shot, so an additional booster, is those with an immune compromising condition. So I would recommend you speak to your doctor to see if you qualify, and that's currently recommended at 2 to 3 months following your third dose of a vaccine. Many people wondered, can I get Pfizer for my first shot and Moderna for my second? Well, yes, that's okay. There's a mix and match approach for the booster for your third shot. So it's okay to get 2 Pfizers and a Moderna, or 2 Modernas and a Pfizer. It's also okay to, if you have Johnson & Johnson, to get a booster with Pfizer or Moderna as your second dose. So people wonder, why do we need booster doses? What's the Does that mean vaccines aren't working? Well, it's not really the case. It's especially common with our elderly population to have the protection associated with vaccine to wane with time. It's just like when we have a tetanus booster every 10 years. If you step on a rusty nail, if it's been 10 years since your last vaccine, you need to go get another one. Our immune system doesn't always have the best memory, and we want to make sure it's especially robust when it comes um, to tackling COVID. Uh, COVID's unique in that it forms these mutations, and these are known as the variants. So we've already gone through two variants with Delta and Omicron. Um, the boosters help our immune systems to recognize these variants better, okay, because it produces slightly different antibodies, which might be more adaptable to the Delta and Omicron variants, and give us better protection. The most important reason for getting a booster is it's decreasing your risk for severe COVID infections. So people can get a breakthrough infection, meaning you get COVID after you have a vaccine, after you've already been vaccinated. But the boosters really reduce your risk of developing severe disease. And as some anecdotal evidence, I've not had a single one of my patients hospitalized following administration of their full vaccine schedule and a booster. Okay. They've all my patients who've had breakthrough COVID infections have had very mild disease and have been able to be home comfortably with their families. There's been a lot of talk, have vaccines, are they still effective? And yes, the answer is yes. We currently have good vaccines against all circulating strains of COVID. So again, you can rest easy that the good boosters are available for you. So common misconceptions. Again, patients have come to me and said, vaccines aren't helpful because we're seeing all sorts of breakthrough infections. And my response usually to that is, if something like polio was circulating at the rate that coronavirus was circulating, we probably would still be having breakthrough infections of polio, despite everyone being vaccinated before they're going off to school. So vaccines definitely limit the number of infections, but it's impossible to be perfect, okay? Just like your favorite Chicago baseball player can't bat 1,000, our vaccines cannot be perfect in how they protect us. Another common thing, patients are concerned they can cause long-term fertility problems, and we've yet to see any evidence that that's the case, okay? I've had several patients who've had problems with erectile dysfunction following coronavirus infection. So I use that as kind of motivation to convince people maybe you should consider getting a vaccine, okay? Because that can be equally distressing and cause for many doctor visits in the future. The other thing I hear often, natural immunity is superior to vaccine protection. I certainly agree that there is a role for natural immunity. Our immune systems are built for protecting us against COVID. The benefit of vaccines is it provides a more predictable form of protection against coronavirus, okay? I really think I've learned during this that not all coronavirus infections are created equally. And I think the ability to produce that robust immune response is more superior with a vaccine. A common tactic that my patients usually say is, I don't want to get my coronavirus vaccine today because, I'd prefer to just get my flu shot today, or I prefer to just get my pneumonia vaccine today. Well, actually, we can do both at the same time. And so if it keeps you from delaying it any further, go ahead and get two vaccines at once. It's okay to do that. The next misconception, I hear mainly from young people, obviously, is that vaccines are not recommended for pregnant women. And the American College of Gynecology does recommend that pregnant women be fully vaccinated against coronavirus. And there's plenty of good data that they're sharing that protective immunity with their child. So if you're pregnant or know someone who's pregnant, urge them to get their vaccine. And finally, with this recent surge that we had in December and January, many of my patients have had a treatment for coronavirus, and that treatment's usually an antibody infusion that we'll get to later. But initially, we were concerned that giving them a vaccine will be negated if they have those circulating levels of antibodies. Well, that's not the case any longer. It's okay to receive a coronavirus vaccine if you've already been treated with one of these new COVID therapeutics. So the side effects and adverse reactions I want to talk about because, again, that's one of the hot topics and one of the major areas of concerns for my patients. So again, if you have a question, I encourage you to just talk to your family doctor about this because usually hearing it from someone you trust can help ease your mind and help you make your decision better. So vaccine side effects are actually pretty common. After I had my first shot, I had a fever, but then after that, I did my second shot without any problems. I'm a little bit of an atypical case in that regard, in that it's more common to have a reaction after your second dose of your coronavirus vaccine. Most reactions are common to have include local site reactions where you got muscle ache or redness where they give you that injection. Also common to have fevers, aches, or fatigue. Less common probably to have some cough or upper respiratory symptoms. I have yet to have a patient who've had symptoms last longer than 48 hours. So it's usually very much self-limiting. And, if it can be improved with taking some Tylenol or ibuprofen if that's appropriate for you. There are rare side effects, and these are common, and I want to include them. So recently, the mRNA vaccines, it's been discussed that there's an increased risk for myocarditis or pericarditis following them. This risk is still small compared to the risk of myocarditis and pericarditis due to coronavirus. That's a much more likely cause for you to be having myocarditis or pericarditis. Myocarditis is an inflammation of the heart. It's usually a limiting illness, meaning it's going to get better over time, but it can cause very non-specific complaints, chest pains. It can perhaps decrease the function of your heart, so you might have some shortness of breath, or some breathing trouble. But it's there, and I want you to be aware of it, and I want you to talk to your doctor about that, okay? There is a small increased risk for Guillain-Barré syndrome. You might have read about that with regards to influenza vaccines. Guillain-Barré syndrome is a neurological disease where you get paralysis that usually starts in your lower extremities and your legs and travels up. Again, this is a limiting thing, but that can certainly cause significant distress in patients and their families. It's rare. I've yet to have any patients have Guillain-Barré syndrome, especially due to coronavirus vaccine. For the Johnson & Johnson vaccine, the rare side effect that we want to discuss is that thrombosis with thrombocytopenia syndrome. So that's the blood clots that you might have read about that have occurred in several of those cases. The reason why Johnson & Johnson vaccine is still available for you is because it's an extremely rare side effect, and the benefits of getting vaccinated, if you're only going to be vaccinated with Johnson & Johnson, still outweigh those risks. But that being said, we prefer to be vaccinated with the mRNA, Pfizer, Moderna products. So a lot of my patients are asking me, doctor, what is going to happen 2 or 3 years from now after I've had the vaccine? Okay. And I tell them, right now we just don't have enough long-term data to make any kind of predictions. Okay, I'm anticipating that we're not going to have any long-term side effects from these vaccines. I'm primarily saying that because I'm very reassured by how they work. Okay, these spike proteins that are produced in our bodies don't last very long. Okay, they degrade like every other protein in our body. Um, and it's out of our system in a few days, I believe. Again, I don't anticipate those long-term reactions. Those antibodies that we produce actually decrease over time as well, and our bodies and our immune systems kind of store those blueprints to produce those helpful antibodies away to take them out if we're ever exposed to coronavirus again. None of my patients have suffered long-term effects from coronavirus vaccination thus far. Um, and then there's been a recent study by JAMA, which was published 2 months ago, that kind of stated that, yes, there are side effects related to coronavirus, but there's also a significant portion of those side effects are likely attributable to the placebo effect of the vaccines. So placebo effect is um, a term that we use in studies where a patient thinks they're receiving a treatment or believes they're receiving a medication, but our brains and minds are powerful things, and it produces symptoms in our body despite them receiving nothing more than a sugar pill or a benign saline injection. So that's the placebo effect, and they're learning that lots of these side effects people report from vaccines are likely attributable to the placebo effect. Furthermore, I really don't know what the long-term effects of COVID-19 infection will be. Okay. We've only had coronavirus for the last 2 years, so we can't predict what is going to happen to those who've been infected 5 years down the line, 10 years down the line. Is it having a significant effect on our cardiovascular system, neurological system? We just don't know. So again, let's prevent that from happening. Let's encourage people to get vaccinated. That brings me to our discussion on long haul COVID. Okay. So, again, to share another story, I had a patient, Rachel, who's 24 years old. She was an avid runner. Okay. Um, I'm talking marathon running. Okay. And she came down with coronavirus in October 2020. And I started seeing her not long after that as a patient. She had to stop running. The amount of um, decreased exercise capacity that she had was dramatic. She really wasn't able to go very far without feeling short of breath. She had very non-specific symptoms of chest pain. Just would always tell me, I just don't feel right. Okay. We've learned that that's a relatively common thing. So 2/3 of people who are infected with coronavirus are symptom-free after about 14 days. Okay. 90% of those patients are symptom-free at 21 days. So if you can imagine, it almost takes 1 month for 90% of people or it almost takes 1 month to recover from coronavirus. Okay. Most people do recover, 90% recover over the course of 1 month. But it's still pretty common to have that remaining 10% have long COVID. Okay. So it's a very non-specific symptom, non-specific syndrome characterized by fatigue, shortness of breath, chest pains. People have gastrointestinal upset, meaning diarrhea. They describe kind of a brain fog. It's harder for them to do their work, focus on conversations, and then very non-specific psychiatric illness, so depression, anxiety. And that's really been quite debilitating for many of my patients. They've had to kind of turn their life around. And I've had a patient who's no longer been able to work after having coronavirus, just because that mental strain of that job was just too much for them. So you learned about vaccines, but I'm sure some of you still have that anxiety. What happens if I still get coronavirus? So currently, we have two outpatient COVID therapeutics that I'm prescribing right now in Duly Health and Care, just because these are the agents that are most helpful with the Omicron variant. There are several other medications available, but right now these are the ones that we're using given the Omicron variant predominance. I'm only covering medications that can be used in an outpatient setting. I just feel it's beyond the scope of this to discuss what we use in the hospital, but there is a medication called Paxlovid that's an oral agent. Okay, we can take within 5 days of symptom onset. It's for those with mild to moderate disease. So when I say mild to moderate disease, it means, you're not needing more oxygen. You can manage your symptoms at home without needing to go to the hospital. And per the report, it's very effective at reducing the risk of hospitalization and deaths, about 88%. Now, it's probably an overestimation. It's probably not quite that high, but it's certainly reassuring to have something that we can give patients to take at home. There's many different contraindications to being on this medication, so please reach out to your physician to discuss if you happen to have an infection with coronavirus. The second product, Sotrovimab, is an IV medication. So it's given in a doctor's office or an urgent care or immediate care. It's to be given within 10 days of symptom onset. So it has a little bit more of a leeway than the Paxlovid. And it's again for mild to moderate disease. So for the patients who do not require hospitalization, it's associated with pretty good data, 79% reduction in hospitalizations and death. Again, they're probably overestimating that, but again, it's reassuring that we have a treatment for coronavirus. So if you are infected or you've been exposed, what are the current precautions that we need to be taking for those people? And this has been difficult because it seems like it changes almost every other week. And, this talk that I'm giving right now might not be relevant if you see this video a week from now. But as of March 15th, here's what the CDC recommends for quarantine and isolation. So quarantine refers to the process that we should all follow following a COVID exposure. So if you have not been vaccinated or recently infected within the previous 90 days, it is recommended that you stay home and away from other people for 5 days after exposure. After day 5, go ahead and get a coronavirus test and then continue to wear a mask for 5 more days. You should always retest should you have any more symptoms or any change in your condition. If you have been vaccinated or recently infected with coronavirus in the past 90 days, there's no need to stay home currently, but you should wear a mask for the full 10 days, okay? If you develop any symptoms, go ahead and get tested right away. Isolation refers to separating those with a confirmed or suspected coronavirus from others to limit spread, okay? So you have symptoms, you might have been around someone with coronavirus, you might have tested positive for it. So it begins on your first day of symptoms, that's day 0, okay? The next day is day 1 and it lasts for 5 days, okay? We want you to isolate during that time, trying to stay away from others in your house, wear a mask if you have to be around others in the home, okay? And you can end your isolation if your symptoms are beginning to improve after 5 days and you've had no fevers in the previous 24 hours. Following that 5 days completion, we still would like you to wear a mask for 5 additional days. Avoid going out to public places where you have to remove the mask, like a restaurant or a sporting event, if you're going to be eating there. I wouldn't recommend to my patients go to any events with a large number of people when they're still in that 10-day period as well. So I'm going to just briefly talk about mask use. Currently with Illinois' COVID numbers, they've lifted the mask requirements in the state. But I encourage patients, if this is giving you some comfort and peace of mind to wear a mask, then without a doubt you should be. Okay. Um, the population of patients who are still going to be prone to a complication from coronavirus, those over 65, those with pre-existing conditions like diabetes, heart disease, obesity, wear a mask. And I think that's a good idea to do until we completely eradicate and are done with this coronavirus pandemic, because it can help provide an additional layer of protection. Okay. I really feel COVID is primarily probably spread at home, because we've been doing a good job wearing a mask, and I want to thank everyone who did. But protect yourself when you're out in public if you feel that you need it. Okay. I've seen a lot as a physician in the last 2 years with kind of the emotional aspects of COVID, where people feel isolated and depressed. They feel like they're missing out on their life. And, with the numbers being the way they are, go ahead and get out, see your family members. Okay. I encourage you to go out and test yourself if you're going to be around others, or have others test if they're going to be around you, if that gives you some peace of mind. But wear a mask if it suits you. And I encourage you to protect yourself in any way you can. Okay. And most importantly, I would encourage you to speak to your doctor about how we can end this pandemic and take care of yourself. Okay. Um, if you have any questions, I'm happy to help answer them. I'll open it up for anyone.
There was one question in the chat asking if there should be any reason for concern here regarding the surge of cases that are currently happening in China. I'm not sure if that's Omicron, if it's like the subvariant of Omicron.
Yeah, and so I don't want to speak to that if I don't, I just don't have that knowledge base right now. So I'm happy to look into it. Maybe I can find a way to reach out to whoever asked that question. Yeah, I'm not aware if it's a new variant right now, and it's something that's kind of to be determined right now. So unfortunately, I don't want to lie and just spout stuff off the top of my head without really giving some thought and looking at the data that is coming out of China.
Absolutely. And it looks like there was another question in the chat asking, how did they tie the blood clots directly to the Johnson & Johnson vaccine with such small numbers?
Yeah, and so they're tying it in that it was an association with those blood clots. Okay, so people had these, I believe they're venous dural sinus thrombosis. So it's kind of a blood vessel in your brain that they had this blood clot, and it's not a very common location to have this clot. And they noted that there was it was kind of an inequitable number of people who had this also had the Johnson & Johnson vaccine. So it's kind of a loose association. Many people had Johnson & Johnson vaccine without having any kind of complications. So yeah, that's kind of, it was just, they happened to notice it, and we're keeping an eye on things. And there is a website you can go to. It's VAERS, I believe, Vaccine Adverse Reaction Hotline. And that's a way you can help track so we can monitor for new side effects that might be from the vaccines, but really minimal stuff we're reporting for the most part.
Great, thank you. That's all I was seeing in the chat.
Mm-hmm. Anything else?
I'm not seeing anything. Thank you so much on behalf of Center of Concern, Next Door, and Pathlights for doing this. And like we said, it will be posted, and we will further send any questions your way if they come to us.
Okay. Mm-hmm.
Yes,
Thank you.
Thank you so much.
Have a good day, everyone. Be safe and go talk to your doctor, please.
Thank you.
Bye.
Thank you.